Hey, well, welcome everyone. I have a great guest today, Jon Gordon, founder of Satoshi Health Advisors. Someone I found through the Bitcoin Business Podcast by Josh Friedman. Listened to that and immediately got inspired. For those of you who know me, I do have quite a bit of family history with healthcare. My wife's a nurse practitioner, family, has her own home healthcare business and others. And the idea of Bitcoin and healthcare, when I heard you speak, Jon, it just kind of like clicked, like, yes. So without further ado, Jon, welcome to the show. And if you just give a little introduction about who you are, what you do.
Awesome. Well, thanks so much for having me on your show, Joe. Always great to great to connect with other Bitcoiners like yourself. And, I find Bitcoin so fascinating because you have people that come from such different backgrounds, all walks of life, and are really connecting around this idea that we can have a return to sound money. And that if we fix the money, we fix the world. And one of the most broken parts of our, of our life and of our systems today in our world is really the healthcare system. And I got experience firsthand working for the last 9 or so years in the traditional healthcare industry. And coming out of college, went into healthcare consulting, was helping hospitals and health systems with their strategy, and seeing how and not really kind of having it click, but seeing how that underlying fiat led to bigger and bigger health systems, more and more centralization, more M&A. And we were coming in and trying to help these systems say, how do we take care of our population, whether they're aging in older states like Maine, or whether we need more ambulatory strategy, outside our city and in the suburbs and post M&A. And it was a great way for me to learn and get practical experience in how health systems are organized, but also the drawbacks of the bureaucracy and all the administrators getting involved and ultimately in the way of that patient-provider connection directly, and wanted to get a deeper sense of the payer side, because even working in the C-suites of health systems, you'd be surprised that in the strategic discussions, some of that had the financial aspects to it, but even that was almost like a black box in a lot of ways. And so I worked in a large payer then in Medicaid, which is the government plan for lower income, which is now even ballooned to over 85, 90 million people in the US are on Medicaid, right? So that's the government payer and insurance, and then Medicare, of course, for 65 plus and disabled. And wanted to, as I kind of kept learning, and felt like it was very at a high level of healthcare and overseeing and looking at things from that level, wanted to get a deeper sense and get more in the trenches. So I had an opportunity to go into medical supplies. We were putting RFID chips in sponges used during surgery to prevent retained objects in the operating room. And that gave me a really firsthand experience working with nurses, doctors, clinicians in the operating space who were trying to be more efficient. And along the way, when you have that stress and pressure in the OR of sponges and things getting left behind, happens a few thousand times a year, unfortunately, here in the US. And during that time, I was doing a double master's in health economics and policy, getting outside the US bubble, understanding how we pay for healthcare and how it's organized, leads to different outcomes in different countries, and really looking at, hey, why is the US spending 2 or 3 times more than the next best country, yet having worse and worse outcomes, and going deeper into the root cause of things. And that's when I found Bitcoin really in 2020. COVID hit. We couldn't sell new products in the hospital. My wife and I started being nomadic, leaving Chicago, traveling around out west, and then out of the country as well, and ultimately led me to wanting to dive deeper into this Bitcoin and healthcare connection. Say we have this $4.5 trillion market where a quarter of the spend is administrative, half of that's waste, almost 20% of the economy. If Bitcoin can fix anything, it should be this market. And so started doing some thinking there, and ultimately landed at Crowd Health, which is an alternative to health insurance, where my wife and daughter and I are still members of Crowd Health. It's an amazing service to opt out of insurance, which is one of the big problems, in healthcare, and was really getting into the Bitcoin space, selling into, and really for your B2B podcast, was going B2B, offering this as an alternative to insurance, where companies are paying 75, 85% of premiums, $8,000 a year for an individual, $25,000 a year for a family. I mean, the numbers just become astronomical to the point you're paying more for health insurance than food.
For sure.
And, but at the end of the day, it's really while the employee could opt out and save the employer a few $1,000s and still get better access to care and go where they want, we found that it's really more of a direct consumer product in terms of Crowd Health. And while there were some Bitcoin businesses and others that wanted, were willing to offer this, at the end of the day, each individual has to make that decision for themselves to, opt out of the really fear mongering that is that you need to have health insurance, or even in 5 states that fine you if you don't have health insurance.
All right.
And so throughout that time, and then last year was helping Crowd Health integrate Bitcoin from a Lightning payments perspective. So for a while you could save in Bitcoin. Now you'll be able to spend and crowdfund each other's bills with the purpose of paying the doctor. So I said to myself, and where are the doctors who are accepting Bitcoin? And that was really the growth and where I wanted to and founded Satoshi Health Advisors to try to help bridge that gap and help educate doctors and clinicians and really anyone in the health tech or business ecosystem in general for these principles on here's how integrating a Bitcoin strategy can benefit your business. And so that's really what led me to today and helping doctors and dentists and architects and e-bike shops and other really across the board for these principles, because as you know, and as you learn more and more about Bitcoin, you want to spend more and more of your time really thinking about Bitcoin and actionalizing it and using it for all the ways that we know it can benefit you personally and then your business. So that's really what led me here now to being in Austin for a couple of years. Is an amazing community around Bitcoin and events and people that are really building in the space. So I'm able to, having built those relationships and connections in Bitcoin, try to bring that now back to the legacy healthcare system where I've worked in and see some of the pain points and say, hey, what if we, plug in Bitcoin payments here? Or what if you start saving in Bitcoin in your independent practice? Because now you can be more independent, be more sovereign for the long term.
Yeah, well, being down in Austin, we need to get you on the Joe Rogan podcast to get this message spread.
Yeah. Hopefully he'll have some more Bitcoiners. I think there's definitely a long list of people maybe before me that will go on there, but he's down the street from the Bitcoin Commons with his comedy mothership. And it'd be great to get someone like Marty Bent on there or, from TFTC or whoever to keep orange pilling. Because I think, we're one podcast away from, really trying to orange pill more of the masses. I think he had Peter Thiel on recently, it looked like, talking a little more, but man, it's we're that close.
I know. No, so I shared a little bit about my background before we came on the camera here. And, I'm sure, realize like in the military, our healthcare for us and our families is I won't say free, but basically free, a very, very small amount. But for the majority, it's all free. If we need any kind of major surgeries, anything really, outside care, whatever, the military generally will pay for that. So part of my challenge coming out of the military is I don't think I grasped the cost of healthcare on the everyday person. And so as I was getting ready to retire and I was studying and looking in how much I was blown away about the cost of just for myself and my family. In some cases, like over $1,000 or more a month is what you'd be paying in healthcare. And I was totally shocked. And so when I saw Crowd Health, I looked at that, heard them on one of their podcasts, and I was like, well, how does this even work? Like, I still had kind of the blinders on. I didn't really see the connection on how you could make this work. So for your average everyday person who's not a Bitcoiner, for them to go towards something like a Bitcoin model healthcare, how does that benefit them? Is it just financially, or like, could you just walk me through, if you're just an average person, why would I go this route instead of what we've all grown up and known with a regular healthcare system?
Yeah, absolutely. And so, it's interesting for you coming from the military background and TRICARE, it's about 3% of the country is on the military healthcare, and you have a specific VA, health system where you're going to get care. But again, that does limit your choice, but it's paid for, right? So there's kind of this trade-off too that other countries even look at in Canada or the UK, where you have a national health service, but at the end of the day, it's coming out of your taxes, and you may have less choice and less access to care when you need it. And the beauty of America in a lot of ways, right? When we should have a free market, and it's not really a fully free market as with how heavily regulated it is.
Yeah.
You should have pricing mechanisms in healthcare. And really, when you have insurance, that gets stripped away. And even the health system itself doesn't really understand their costs of production. And as an everyday consumer, say you're on an employer, about half the country is on commercial plans. So getting health insurance through their employer. You're paying 250% more for the exact same service than the government pays that hospital. So the difference, and even the way that the health systems can stick around, is that differential of charging more to commercial private payers than what the government pays. And so if you actually opt out of that system and, for example, be just uninsured, there's about 25, 30 million people in the US that are uninsured. Even better to join something like Crowd Health, where you have now the community to help crowdfund bills over $500. You'll realize that the cost of healthcare actually doesn't need to be so astronomical. And you can find somewhere in between that government rate and the very high commercial rate, where generally we're getting 50% off the kind of sticker price of healthcare, at least, by just being uninsured. And because the way that the insurance system works is that you have a payer, a provider, and then a consumer of healthcare. These are three different entities. And in the middle, you have risk, ultimately, right? Health and financial risk. It's uncertain if you're going to get something, you can get sick in the future, right? And so that's kind of the reason why people would join insurance in the first place. But it's gotten so bloated to the point that, and perverted too, where there's a law now that the insurers, so like the United Healthcares, the Aetnas, CVSs of the world, can only make 15% profit. It's called the medical loss ratio. So for every $100 in premiums they bring in, they have to spend 85 on medical care. But by capping the percent of profits, the only way for their bottom line to grow is by raising the top line prices and premiums. So you've given up as a consumer now. Your agent is the payer, the insurance company. They're the ones negotiating with the providers, the health systems, at these larger and larger scales on prices. And hey, what is the price going to be next year and the year after? And they're sort of in cahoots together for the prices to go up. Right. and ultimately, that's what we've seen, right? With over a 250% increase in healthcare prices in the last couple decades, outpacing all other industries. And so you have these underlying perverse incentives where now if you are a part of that system and you're getting commercial plan, as much as you think it's great, or your employer pays for it, or most of it, it's coming out of your paycheck. And that should be money going into you that you can spend on whatever you want. If you wanted to spend it on healthcare, great. But if you wanted to spend it on a car, or you wanted to invest in something else, or like buy some Bitcoin with that money that you're spending,
for sure.
Ultimately for the peace of mind to say, if something happens to me, I have the support. You can opt out of that and be a consumer, an active consumer health, to say, I'm going to actually find out the price of what this is before I go do it. If you go and take in your car to get checked, or you get in a wreck, right, you're going to get an estimate. And that doesn't happen in healthcare. You need a knee surgery, you show up, they send you down the system, referrals here and there. Oh yeah, you have insurance, you're great. And then you find out, oh, wow, that was a $20,000 surgery and I have a $4,000 deductible, right, which is the amount you have to spend before the insurance even pays a dime. So, you're spending, and for family of three, if you're on the exchanges, so that's the other kind of piece of things is Obamacare, right, came into Affordable Care Act 2009, 2010, which created this marketplace exchange for insurers to offer plans for entrepreneurs, small businesses, and so on, or really, especially entrepreneurs. It's an individual marketplace, right? And if for businesses up to 50, you're not required to provide health insurance. A lot of them do to be competitive, or they'll say, hey, we'll give you, stipend, go to marketplace, which is heavily subsidized. But I'd probably be spending $1,200, $1,300 a month on premiums alone, plus a $4,000 or $5,000 deductible. Versus with Crowd Health, we're spending $400, $500, $600 a month. It depends on the actual utilization in the community, right? So we're paying $50 a month to be a member, and then up to $135 a month to crowdfund other people's bills. So it does change month to month, and now we're actually incentivized to take personal responsibility for our health.
Yes,
because at the end of the day, the bill's in my name, and yes, Crowd Health can help us crowdfund, and we have other people that are generous, and you get a generosity score based on your track record of giving. So it creates the right incentives for people to not only give and support, but also do the diligence up front to say, where am I going to go and get the best value for my care?
So we've talked about from the patient or the client side of this. So talk to me about on the provider side, whether it's a dentist, doctor, small practice, even veterinarian, I guess, right? Because a lot of them don't even, they could accept cash really, right? Can you just talk me through that process of how this benefits them and how they can make this work for their practice?
Yeah, absolutely. And, started talking about value-based care, value really being that equation of quality over cost. And for every provider to demonstrate in the marketplace, hey, why should you come and get care from me as a doctor? What value am I going to provide? I'm trying to give you higher quality, better access, and at a lower cost. And ultimately, providers can do that when they have time, right, to spend with you, and they're being compensated a fair amount. And when you're being paid by insurance, the doctor's average visit is about 7 minutes. They don't really have time to spend with you. They have to see more and more patients in order to get enough reimbursement from the insurance company. And the insurance company doesn't actually pay out for services provided for 2 to 3 months. So imagine managing a revenue cycle where you're not paid for your services for months on end. Those claims get challenged, get denied. Your patients need prior authorization before they can go and get that service. So all these hoops that doctors and providers, dentists have to jump through in order to just run their business is crazy. And the administrative burden to go and reimburse and have all the different fields needed for that insurance company to pay you. So when you cut that out and you say, I'm going direct to consumer, I'm going to just say, this is the price for this service, this scan, this image, or to be a member of my clinic for services like direct primary care. So that's a big area that I'm targeting, and working with in my business are direct primary care physicians who are usually family medicine, maybe nurse practitioner, internal medicine. They have, instead of needing 2,000 to 3,000 patients for them to be profitable on traditional insurance, they only need really 300, 400, 500 patients that are paying them anywhere $50, $80, maybe $150 a month, depending on the type of service that you're getting. It's really concierge medicine, 24/7 access. And now you can really build that relationship with the doctor where they're seeing you for an hour or even more for your annual. And you're talking through your lab results, getting at the root cause of what's ailing you, rather than just pushing, medications to try to heal all wounds. And so those providers can really benefit a lot, not only from ditching insurance, but now ultimately integrating Bitcoin, because Bitcoin is the ultimate tools we know to save for the future, strengthen that treasury. And what's the most efficient way to get Bitcoin? Accepting it as payment. You don't need to pay the 1% fee. You just say, hey, here's my price if you pay me in Bitcoin. And oftentimes even you can incentivize that as a doc too, maybe discount or you add a fiat premium. There are certain specialties you actually can't do that because it's so regulated, like dentistry, for example. You can't even discount because of some of the laws. But anyway, you can play around now with some of the incentives and really even encourage, healthier behaviors and build a longer term relationship with your consumer when you're going direct. And now not only are you not, you're getting paid direct, right away, instead of 2 to 3 months, as we know with Bitcoin, if you're paying on chain, that's right, an hour for 6 confirmations and 6 blocks, or with the Lightning Network, you're getting paid at the speed of light, at a fraction of a penny cost, from anywhere in the world too. And as with the rise of telemedicine and the ability to provide care remotely, you now can also tap in. Of course, there's also regulation around where can you provide care in which jurisdictions and states and so on. But I think we're moving more in the direction of people that are very comfortable to talk to their doctor, like we are now over Zoom and or over telemedicine. And now you can get direct settlement instantly. And that does wonders, I think, for that revenue cycle management of your clinic. And maybe you only have, and these are usually profitable businesses, right? So in healthcare and in pricing it, you have your costs of maybe you have a physical space, you have a nurse, you have a team, your staff, but you should be able to, you're providing this valuable service. So if you can save for the future, it resists the temptation and even where a lot of it's in many cities in the US, it's even hard to find independent doctors anymore because they're getting either bought up to be employed by the health system, or private equities coming in maybe and buying them and trying to do this, run the insurance hamster wheel to try to make as much profit just as possible. But then it's leading, especially in the health system world, to a lot of burnout. And we have huge shortages of doctors, particularly in more rural areas as well. And where you had that model of like a community doctor for so many years, of someone you would rely on, that's going away in a lot of senses. And now you got to drive to the big city, and navigating that as an individual is incredibly challenging. Right. Even someone, for me, who's worked in healthcare, it's like, we try to avoid the hospital or the health system, right, at all costs. And if you need to use it, of course, for interventions, and there's amazing technology that's been integrated into healthcare, which, as Jeff Booth says, should be driving down the price of goods and services. But instead, we still have the price of things going up. So I think, healthcare would look a lot different on a Bitcoin standard. And it's really interesting to think about, your wife being a nurse, and then having, the home health business in the family as well. And when you're close to providers like you are, and having, you see the challenges day in, day out, and the frustrations in working that system, where they got into it to really work with people on their health, try to help them get back to their, 100%. And it just becomes frustrating year over year, day in, day out, to have to deal with that bureaucracy and the administration and so on. So even for like a home health business, it'd be really interesting to say, what would this look like where we're accepting Bitcoin, and you can now get these services directly, because of course that's more of a Medicare population. It's going to be 65 plus, and you say, oh, well, the government's paying for this, but Medicare is slated to run out of money in a little over than a decade, right? Yeah. And they're actually paying doctors less year, and the home healths are receiving less and less reimbursement every year for, sicker and sicker, to take care of higher acuity patients. And so I think we need to build those businesses that we know we're going to need, like home health. We're all going to get old. We're all going to need some support. It's a much better model of care too than having to go into a nursing home, or, you can still have some autonomy and sovereignty in the way you're living your life as you age, hopefully healthfully, and just catering maybe more to, the caregivers, or the patient's caregivers, or maybe their kids, or, younger, maybe the more of a millennial Gen X. And they say, I'd rather have a higher quality service and pay for it directly, rather than try to rely on whatever I can get from the government. And that's where Bitcoin, I think, really plugs in. And that's a really greenfield approach right now, where there's not anybody, specifically more in the post-acute care, nursing home health industry doing things with Bitcoin yet, just because it's, we still have the government payer, and, I'd love to help businesses like that. And, but for now, I'm focused on businesses that can really plug and play Bitcoin quickly. You have direct care, you have dentists that are boxed out of insurance. You have, it'd be great to see health systems maybe putting Bitcoin on the balance sheet from a treasury perspective. They're sitting on, their cash is, they don't necessarily have a ton of cash days on hand. The margins can be tighter, but at the same time, they're bigger entities and would benefit a lot from even just putting, a couple percent of Bitcoin in the balance sheet, if they really are trying to be independent and, resist the urge for continued M&A on paper. You look at these bigger and bigger health systems, you have the Kaisers of the world, the Ascensions of the world. Some of them are even nonprofits, right? Like it's kind of a joke at this point. Like they're not operating, they're not nonprofits, but they're getting tax exempt status. They're not, it's just a racket all the way around.
No, I hear you. No, so as an administrator, I hear instant settlement on pay. You have self-sovereignty of your company. Treasury has, I think we have said, do you think Bitcoin is going to be worth more now in 10 years? Or what's the buying power of Bitcoin in 10 years versus the dollar? So if you're saving in that. Customer base, while everyone, some issues are, they're no fault of anyone, right? But general healthcare, do you take care of your body? Do you eat well? Do you, all those things. So you generally have a customer base that is generally healthier. It puts a lot on the patient to take sovereignty of their lives make better decisions because they're tied to that payment method, right? As far as, as payment. And then as a provider and as a patient, I see less people on a daily basis, but I spend more time with them. So you develop that personal relationship with your patient. The doctor knows, like you said, like a small town doctor who knows everyone in the area. They know the ins and outs of that patient. And by that instant settlement, the payment, you're able to see less people, but have that better approach as opposed to, as one provider, let's say in an urgent care, I see 70 people in one day, like my wife used to do, especially during COVID, 70 people over a 12-hour shift. Come on.
Jeez.
Like, you know what I mean? Like, one, what does that do to the provider? Extreme burnout over time. You just go in, you see after a nurse, does the vitals, you go, okay, you good? This. Okay, here's a script. Talk to you later. Make another appointment in a week. You know what I mean? I don't, it's hard for me. And again, this is me as a Bitcoiner. And so I definitely see things through a different lens than a lot of others. But what challenges, because to me, this is like perfect. What challenges do you see on your end on either providers? And I know you mentioned some regulations change, depends state to state. What are the big challenges you see on providers or even companies or urgent cares or primary care initiating accepting Bitcoin and making that part of their practice?
Yeah, that's a great question. Yeah, I think it's that integration into their way they operate today and trying to limit the extra steps that need to take place in order for you to accept Bitcoin. And I think the big hang up still today is going to be none of the electronic medical records are natively integrated with Bitcoin or Lightning payments, right? They could be one day down the road. And I think building towards that future as well, even where individuals can own their own healthcare record. And that's something I'm collaborating with some folks. We're looking at, hey, can Nostr be used as this data communication, taking, having your ownership of your data, selectively sharing that with the doctor. So I think moving more towards that sovereignty, autonomy, and patients or just consumers, individuals wanting to take control of their health and being there from a consumer base, right? Because I think, a challenge for the doctor too is going to say, who's going to be paying me in Bitcoin? And so I think it starts with the merchants and a lot of Parker Lewis's and pay me in Bitcoin theory. I subscribe to that for sure, but it also will come from individuals asking their doctor, just talk to them and say, hey, can I pay you in Bitcoin? Or I'm already paying with credit card. I'd rather pay, in a more private way, or I'd want you to be more censorship resistant to getting cut off from the banking rails based on the way you're practicing medicine, which we've seen happen as well. So I think, sometimes we need to touch the stove a little bit, and maybe it's still abstract for some providers in the US to say, oh, I'm not going to get, why would I get cut off from the banking rails? But so I think the hang up still too, one of the challenges, pain points is just education and understanding of, here's how Bitcoin works, kind of dispelling some of the notions or FUD that's around it and saying, this is actually, if we spend a couple hours, and this is what I do in my projects, and saying, here's what is money, here's the fiat system, here's Bitcoin. And now we have a baseline understanding of how Bitcoin works, how mining works, what are nodes doing, what is the Lightning Network? How do I tap into that? There's amazing tools that are being built right now that you can plug into your business. And whether it's something like Zapprite, where you can just accept Lightning and Bitcoin payments alongside fiat, right? Credit card, ACH, whatever else you want to do. Or you want to plug in, Strike into your Shopify store, or you want to add Oshi as rewards and, get creative about how you're going to grow your customer base. So I think there's a lot of great tools that can really add value to providers, urgent care doctors into their businesses. And, especially surgeons, others that are already along the lines of, I'm going to give you a fair price. This is the price of my service. And those are the kinds of providers I'm trying to reach out to, because they already get it from a values perspective. They're already so aligned with Bitcoin. And now the main piece is, okay, now practically, how do we plug in Bitcoin to be able to save for the future and have that 150% purchasing power increase, year over year for the last decade, right? It might not continue to that extent, and it probably won't, but you're still going to be, kind of insulating yourself from a lot of that inflation and inflationary pressure you feel with the other costs you have, whether it's your supply chain or labor, staffing concerns. And so it's just, I think, bridging that gap of saying your business model is really already aligned to plug in Bitcoin. Here are the ways to do it. It doesn't need to be super complicated. And you may not see a ton of patients paying you right away in Bitcoin, but now you're set up with that redundant payment rail. And now, if shit hits the fan, or, when it comes time to saying, your payer, like for Change Healthcare, for example, just to put it in perspective, were bought by United, one of the biggest companies in the world. They were hacked earlier this year, and actually, funny enough, paid like a $20 million Bitcoin bounty to that.
Oh gosh.
And all this data stolen. They process over 1 trillion claims a year, like just a crazy number, and they still owe doctors and providers $10+ billion for services they provided months ago. And that created massive strain for doctors and providers that were reliant on those Change Healthcare reimbursements through insurance. And now all of a sudden those weren't coming through because of the hack. And many of them actually were having to close down, or ironically, or not ironically enough, literally getting bought by United Healthcare and coming and swooping in and buying these practices for pennies on the dollar because they're cash strapped and stressed. So that can happen to any business, particularly when you're reliant on a third-party payer. So what's going to strengthen your business and set you apart, especially early on, where you're going to probably be a first mover in a relatively slow legacy moving industry, to market, to cater your services towards Bitcoiners that want to put in that proof of work, right? They're already questioning where the money comes from. Now they're questioning the directives from the CDC or other health organizations, or what should I be eating, and questioning nutrition, getting sunlight, moving your body, doing all the things we know we need to do to be healthy, but wanting to find a provider that they can work with and still dig deeper into certain areas of the body. Of course, we're not going to know, everything, but if you're just going to see your doc for 5 minutes and they're, running labs and not even following up, like, are you really going to be able to actionably change your behaviors or change your habits to live a healthier life? It's going to be really hard. And so, really my message to doctors or providers is, I think it's all upside for integrating a Bitcoin strategy, and you'll be setting yourself apart, not only benefiting your business today from lowering your transaction fees, saving a bit, and increasing your margins there, but ultimately growing your practice, sending out that bat signal to others to say, here's the way I practice medicine is aligned, is holistic. And, that's where this is relevant for all businesses. It's not just doctors, it's the chiropractors, it's the naturopaths, it's everyone that's even been boxed out of the very Western medicalized approach for alternative modalities that are especially healing too for veterans or for others that have experienced, or experiencing PTSD or other mental health challenges, that they can really heal and address the root cause, rather than, being thrown some more medications or pills here and just staying on that, on that hamster wheel. So I'm hopeful that, integrating Bitcoin into healthcare can start to move the needle a bit, but it's going to take a lot of people, a lot of individuals and others like yourself now, and really trying to help businesses and business owners who are really busy just trying to run a profitable business, spending a few hours and showing, hey, this investment in this project, in a consulting project to get you set up and implementing, here's how it's going to benefit you down the road.
Yeah, no, I think, as we talk more later on, there's that common saying from Satoshi, what if you don't get it, I don't have time to explain it. But I think we're at the point now where for this to continue and to help the rest of really everyone, because this is worldwide. And I could see like something like this even being put into play a lot sooner in maybe some underdeveloped countries where it's even on like the app Fetty that just got released, right? Like, I think the use of that could be tremendous. I think that's the beauty of what we're trying to do, where we do take the time and we offer, maybe a webinar, or people can sign up. It's a small class, limited, even if it's virtual or in person, a small class where we take the time and we'll walk some of these entrepreneurs, small business owners, practice owners, put them through like an hour or two session with the opportunity to come back and learn more, where it's more intimate. Because if we just go out and say, hey, read the Bitcoin standard and read fiat standard and, read broken money, I mean, that sounds great, right? But those business owners or those clinicians, they don't have time. Like, they just don't have time.
Exactly.
So if they have someone like yourself who can get on a call with them and, hey, look, here's the basics. Here's a quick presentation. I'm available for further discussion if you're interested. Like, I think that's the beauty of this consultations and things like this, especially with healthcare and small business owners. Because if you're, I'll just say Walmart, I'm thinking of a giant corporation, right? If you want to learn about Bitcoin, you have your chief financial officer and his team put together a brief, and they may say, this is trash, we don't want it. And then they got to convince a board of shareholders and all that. But as a small business, you have that opportunity to come in, like you said, as a first mover, start establishing yourself early. And then once it clicks for everybody else and the big companies start coming in, you have already positioned yourself in a position, in an excellent opportunity to sustain your business, to have grown. Because again, like we said, in 5 or 10 years, is the dollar going to be worth more, or is Bitcoin going to be worth more? Is the dollar going to continue to drop? What is the case? And so taking that time to really give, executive level support to some small business owners who may not necessarily be used to that, I think that's critical for this development. And I think once, people hear you and they see your presentation and how you walk them through this, if it doesn't click right away, it gives them something to think about and then to call you back. So have you seen, and this is really my last question because I've taken a lot of your time, have you seen a certain area or region, whether it's in the US or anywhere in the world, who's adopting kind of what you're doing with Satoshi Health? Like, I'm in the middle of Kentucky, south of Louisville. I would guess there's not a ton of people in where I live who understand Bitcoin, mess with Bitcoin. I know in Louisville we have like a Louisville Bitcoin meetup, and there's some people up there, bigger city. But like, if you have a home health here in the middle of Kentucky, it's probably not going to get a whole lot of Bitcoin people paying in Bitcoin at this time. Are you seeing a region or an area that's maybe better off than others, or what do you see?
Yeah, I think especially, in the US, you do see some stronger pockets or more dense cities where you're seeing Bitcoin activity and more builders. I mean, being in Austin the last couple of years, definitely spoiled, being surrounded by a lot of builders. But even then, you'd be surprised, like, there aren't a lot of merchants necessarily, in the area accepting Bitcoin. I did work with an e-bike shop, Mod Bikes, and we've had Austin Bitcoin Club there. They've sold some bikes for Bitcoin, and really, they were new into Bitcoin and learning about it, even saying, oh, we might, need to turn some Bitcoin, it'd be a cash intensive business and get back into fiat. But then the price goes up and they say, actually, we can hold some of this Bitcoin, a little bit longer. And so I think it's just like that gradually then suddenly of more businesses just seeing, hey, this is really what it can do to my balance sheet, even if I'm just hodling some of the few transactions I make in Bitcoin. But even then, even there, we would think we'd have more coffee shops and more restaurants in here. But I think in the West, we're still just so limited, or people are hesitant from a capital gains perspective. But look, there's tools like Strike. You can spend fiat, turn into Bitcoin, speculative attack, and be able to utilize the Lightning Network without having to spend your Bitcoin. And so, Nashville, Austin, I've been in Charlotte. I think you see, PubKey in New York. There's different meetups that are starting to really gain a lot of traction, I think, in different towns. So that's, finding your local Bitcoin meetup. I'm a huge advocate of that. I was just meeting actually this morning with some Chicago Bitcoiners for coffee. I'm back in Chicago for a little bit right now, and
awesome.
Always trying to see where that's going to happen. And so those cities where you do have more Bitcoiners, I think businesses can really lean into that. But that's where e-commerce, a lot of small business owners are selling it, maybe a more niche health product or beef tallow or beef, that have leaned into the Bitcoin community. It doesn't necessarily matter where you are, and that Bitcoin consumer or cohort is really growing, and it doesn't matter what city they're in, and you can still reach them. So I'm excited to go. We're actually heading down to Costa Rica shortly, and they have a really strong circular economy that I'm excited to experience. Been to El Salvador a couple times, and I think going, and I've been in South Africa as well, Bitcoin and Kasi. Like, you're seeing a lot of bottom up, really decentralized communities, and whether now they're using apps like Fedi and eCash to be able to do that, or they're still just using the Lightning Network and bypassing those credit card terminals. I have a lot of hope in seeing different communities leaning in, but it starts with those business owners who are saying, hey, that's an option to pay me in Bitcoin. Maybe you're incentivizing it in some way through, or even just offering rewards. And then finding those loyal customers and seeing, hey, those Bitcoiners are going to keep coming back if you're giving them sats back, and those sats have now appreciated in value, and they can buy some more of your good that they're gonna want. And so that creates more of this circular economy, more of, but I think I did see I have friends in Austin getting on zero, fiat, and going, all in on Bitcoin, and there are more tools like Fold that really enable you to be able to do that. And so it's that personal, I think, conviction. And as you continue going down the Bitcoin rabbit hole and you realize where you spend your time and money and your energy, where do you want to store that value? And do you want to store it in the system where we have a fixed supply of 21 million Bitcoin that will ever exist? And, you can get your share and be able to spend that into the future and what you need. And it really does lower your time preference. It does enable you to think more towards the future with a more freedom mindset, rather than saying, oh, I'm going to be having some fiat investments or stocks or things where even you have the flash crash, 2 weeks ago, and everyone freaks out and then forgets about it like a day later, and these cycles just feel like they're getting so much quicker and more violent, and the volatility is really going to be there. But if you're in Bitcoin and you're holding your own keys, that stress, it really isn't there. And if you can provide something that's of value to the world and find your consumer set, and people that you can help, that's really the goal and the dream. And then you can have that flexibility, get paid in Bitcoin, see the work that you provided a year ago, all of a sudden is now, oh, that's a lot more now. And, that's a cool feeling. Right? And I think putting those, flipping that back, I have a doctor now in San Antonio who I'm helping, and he's just even walking through the process of how am I getting Bitcoin, and how am I going to be, paying you in Bitcoin, because there's a fiat premium attached to that. And okay, that's what my patients will be thinking about if I say, okay, you're paying me in Bitcoin, and because it is a process. And as you know, and I think you nailed it on the head, where not every one has the time, and there's great free resources and books and podcasts out there that you can listen to, and highly recommend that. But if you want just a deep dive and more of a crash course, and saying in something personalized to your business model, your goals into the future, that's where I think tapping in to a consultant, and what I'm trying to provide with Satoshi Health Advisors, where I'm trying to add value to speed up that process, plug you in right away. And then so you can get your name out there. And we're seeing certain companies that, even going viral, even if it's in the Bitcoin world or even more generally, you're seeing public companies like Assembler Scientific and healthcare, and that's a business owner now that really gets it, and he has enough power in his company to make the moves. So do all small business owners that are private, that are not going to be making public headlines, but you can make that difference in your business, right away, and start to see the benefits slowly, and realize that, hey, this might not feel like a huge change all at once, but it also won't be a huge step. And maybe there's some manual processes to start, and eventually, as the tools get better and as we plug in the Bitcoin tool APIs to your EMR APIs or whatever it is, there's going to be things we can build that, are really on a Bitcoin, built on Bitcoin rather than being plugins. But we'll get there slowly and surely. So would love to get, down in Kentucky and see home health happening on Bitcoin, that I really like today. That's, maybe it feels far out, but at the same time, even if, you start saving in Bitcoin or start seeing, who's showing up in the Louisville community, what are the needs in the community, then all of a sudden we could see, hey, this, this starts to make sense.
For sure. Yep. No, I mean, I was at the conference as well. And I think not only Simon Scientific, but OneMedNet announced that they had bought 1.8 million Bitcoin. I mean, I would say a big part of that theme, aside from the politics, was businesses looking to adopt Bitcoin as part of their treasury, whether it was on the main stage or some of the side stages. That was a discussion that is happening more and more and more. And so I think we're, I'd say like a blue ocean type of strategy right now, where right now there's not many companies doing, I don't know of anyone doing the healthcare like yourself. And then even the just bottom line consulting business to business is very minimal. So I think there's a lot of opportunity to grow, and I'm really excited for the future with Bitcoin for businesses and home healthcare in general, and what this could do, as we talked about self-sovereignty, better access to care, better quality of care, and not only better decision-making by the patient themselves on ways to live healthier. So, Jon, I definitely appreciate you. I will have the Satoshi Health Advisors website in the descriptions. I have your LinkedIn. I have all your contact information there as well. And I'll be sharing this to anyone who watches the video in descriptions, and then also on Fountain and Spotify and other places. So, Jon, again, thank you so much for coming on. I truly appreciate it. And not only for coming on, but what you're doing to help Bitcoin adoption and adoption into healthcare, which is near and dear to my heart. So thank you so much, Jon.
Awesome. Joe, thanks so much for having me on. And a quick plug for a masterclass having next Thursday as well. So I had one on the Bitcoin and healthcare connection in June, and now I'm partnering with an optometrist, Alan Bryden, who's out of the UK and has been accepting Bitcoin in his practice for a few years now. So that'll be August 29th, 2 p.m. Central Time next Thursday. So not sure when this comes out exactly, but you can find the info there on SatoshiHealth.com. And we want to make it even more of a discussion, get business owners, providers on there talking through these pain points. It's showing proof of work too, right? Not saying it's going to happen right, in 1 second, but we can get there. And I think having those shared practices, collaboration that you see within the Bitcoin ecosystem is the best, because we're all, at the end of the day, on the Bitcoin marketing team. There's no CEO, there's no central direction. It's, hey, what can add value, and in this decentralized way. So really appreciate you having me on, Joe, and connecting, and hope that we can collaborate even further into the future.
For sure. Thanks, Jon.
All right, take care.